Hello, my name is Megan Falconer, and today I will be talking to you about Lyme disease. Lyme disease is caused by the bacterium Borrelia burgdorferi. This bacteria comes from the eubacteria phylum Spirochete. It is an obligate parasite that is zoonotic and vector-borne. It stimulates an immunopathological response in humans. It is only found in the black-legged ticks in certain areas of North America and Europe. Its mobility is due to its endoflagella. This bacteria is much longer than it is wide. It is 0.2 to 0.3 micrometers wide and 15 to 20 macrometers long. Due to its very thin width, it is not possible to observe this bacteria on a compound-like microscope. Electron microscopy or dark field microscopy is recommended. The vector that transmits this disease are ticks of the genus Ixodes. In the United States, the two species that transmit this disease are Ixodes scapularis and Ixodes pacificus. In Europe, the species that transmits the disease is Ixodes ricinus. The tick acquires the bacteria during its larval feeding. When the larvae molt into nymphs, they feed on small mammals, such as rodents. Most human infections are a result of bites from the tick during the nymph stage, because their small size makes it very hard to detect. When the nymphs molt into adult ticks, this is when the tick is more likely to feed on larger mammals such as deer and humans, except at this point in its life cycle, humans are much better at noticing and removing the tick before the disease can transmit. Ticks transmit the bacteria to humans when they bite them. What they'll do is attach to a part of the body in hard-to-notice places, such as in or around the ear, in the scalp, armpits, and groin. As the tick continues to feed on the human, the disease is transmitted. However, in most cases, the tick must be attached to the human for 36 to 48 hours in order to transmit the bacteria. Most often, nymph stage ticks transmit the disease to humans because, as you can see in this picture, they are much smaller than the adult stage ticks. Adult stage ticks are much easier to notice and are oftentimes removed long before they can transmit the bacteria. Lyme disease is often broken into stages based on duration and symptoms. Most often in the first stage, which is called the early localized stage, an erythema migrans rash will appear that looks similar to a bullseye. This rash is the most identifying symptom of Lyme disease. The rash appears about 7 days after the insect is bitten and will continue to expand in the days ahead. Also in this stage, the victim experiences fatigues, chills, headaches, muscle and joint aches, and swollen lymph nodes. The second stage, called early disseminated stage, occurs days or weeks after the bite. Hallmark symptoms of this stage include facial palsy, which is loss of muscle tone in one or both sides of the face, along with more erythema migrans rashes and inflammation of the spinal cord, which often causes neck stiffness and severe headache. Sometimes in the early disseminated stage, symptoms can go away without treatment after a few months. However, 60% of untreated Lyme disease patients enter the later disseminated stage, which can last months to years post-bite. This stage is known for intense bouts of arthritis, joint pain, and swelling. 5% of patients during this stage develop long-term neurological consequences, such as damage to short-term memory and tingling in feet and hands. For patients who receive treatment during the later disseminated stage, oftentimes 10 to 20% of those patients will experience lingering symptoms even after the treatment. These symptoms can include heart or cognitive defects, fatigue, and joint pain. It is not sure whether the bacteria is continuing to cause these issues or if it is just tissue damage from when the bacteria was in the body. Here I've given you some photos so you can clearly get a good idea of what the erythema migrans rash looks like, the trademark rash of Lyme disease. In the bottom left, you can clearly see a bullseye-looking rash. If you see a rash that looks like this, you can be almost certain you have Lyme disease. However, if you look at the patient above, in the top left, this patient had to go through further testing to be certain they had Lyme disease. The bullseye is not quite as distinct, but this is an erythema migrans rash of Lyme disease. On the right, we can see photos of rashes that appear more faint. The darkness of the rash does not indicate the severity of the infection. No matter how the rash appears, one must seek treatment as soon as possible. Here in the top left, you can see an illustration of a man who is suffering from facial palsy, a hallmark symptom of the early disseminated stage of Lyme disease. The bacteria is causing a loss of muscle tone on one side of the man's face. Also, I provided a picture in the lower right of the greatness of severe swelling that occurs during the early disseminated stage and possibly become a permanent consequence of Lyme disease. Patients treated with the appropriate antibiotics during the early stages of Lyme disease usually recover quickly and completely. The antibiotics commonly used for oral treatment include doxycycline, amoxicillin, and ciprofloxacin. Physicians have been experimenting with a long-term strategy of antibiotics to deal with patients that suffer from chronic Lyme disease symptoms. However, the results of this have been inconclusive, but what they do know is this is not helping to repair cognitive issues associated with the later stages of Lyme disease, because they still are not yet aware if the bacteria has been completely eradicated from the body. Lyme carditis is a form of Lyme disease that occurs when the bacteria of Lyme disease enter into heart tissue and interfere with the heart's electrical signals. This results in what physicians call heart block. The symptoms of heart block include lightheadedness, fainting, shortness of breath, heart palpitations, and chest pain. This only happens in about 1% of Lyme disease patients, although I have a friend from home who had to experience this. Lyme disease carditis is usually treated through vigorous oral and intravenous antibiotics, although sometimes patients require a temporary pacemaker. Here's a picture of what happens when a Lyme disease patient is experiencing heart block. The electrical signal from the AV node to the ventricle is completely blocked. The ventricles begin to beat on their own at a much slower rate. Each year since the discovery of Lyme disease in 1975, there have been more and more people identifying their symptoms and receiving treatment for Lyme disease. There was a statistical analysis between the years 1992 and 2011, and in that period there was about 381,000 reported cases. 95% of those reported cases occurred within only 14 states. In the United States, the tick only resides within the New England and the Midwestern states. As you can see in this picture, I cropped out half the country since there was almost no cases west of the Mississippi River. As I said before, most infection is a result of the tick biting in its nip stages. And since the tick is usually going through those nip stages during June and July, that is when people are most likely to receive the infection. The vaccine Lymerix is on the market, which is a non-infectious recumbent vaccine. However, the best way to avoid the disease is to avoid getting bit by the tick, since this is the only way to receive Lyme disease. The only time you really need to be concerned about getting Lyme disease is if you are in one of the 14 listed states in New England or in the Midwest. If you are in those states, it is best to remember to stay clear of wooded or long grass areas. And if you are on a hike, make sure to stay in the middle of trails and wear insect repellent that is at least 20 to 30% DEET. When you return, make sure you check your entire body, especially in hard-to-notice areas, and make sure, especially in June and July, look very closely because the Lyme disease ticks are very small. Ticks can hide in gear and clothes and the fur of pets, so make sure to check there for ticks. Also, if you do find a tick, you remove it with the tweezers. Shower immediately, help rid yourself of any other ticks, and tumble dry your clothes on hot for at least an hour. Thank you very much for listening. If you have any questions, please do not hesitate to ask, and my references are right here.